moving forward, we've kind of touched on this a little bit. Is there any molecule out there that's currently in the metastatic space, or regimen or something out there that you have some suspicion may lead to new developments in the early stage breast cancer space?
Yeah, I mean, I think there's a couple of other drugs that are currently not approved adjuvantly. So if we look at trastuzumab deruxtecan, one of our newer approved agents that I mentioned previously, I certainly believe we'll see results coming out in the future about the role of that drug in patients with residual disease. Likewise, we've seen a number of trials try to look at the targeted therapies, the antibody drug conjugates combined with pertuzumab to see if there's any benefit to that regimen, whether toxicity or efficacy. So far, we've not really seen that come to fruition, but I think that's an area.
Is that the Caitlin trial you're referring to there?
Yes.
Okay.
Yep.
Do you want to expand upon those results just briefly?
Sure. So like I said, Caitlin looked at using the adotrastuzumab emtansine or TDM1 in combination with pertuzumab versus trastuzumab, pertuzumab, and paclitaxel together, or a taxane rather. After these patients received the anthracycline therapy as an adjuvant treatment for high-risk HER2-positive breast cancer. So based on these results, we did not see any significant benefit to using TDM1 in place of the trastuzumab and taxane combination. In terms of toxicities, more patients discontinued the TDM1 arm due to adverse effects than the standard of care taxane trastuzumab arm, which I thought was kind of interesting. So I think that's one of multiple trials that have tried to look at using pertuzumab in combination with these combo therapies.
I think we've kind of seen that. If you're totally looking in the adjuvant space, so a couple of these trials we've looked at, you're really scraping some very thin margins. It's hard to improve on something that's, although we need to improve on it, it's hard to improve on something that works so well, just like trastuzumab. And so that's where, again, I think of all these new things, and we've talked about the Catherine study is, again, really what stands out. Mm-hmm. Because that's a different treatment approach. It's not just an additive or, a slight tweak to a regimen. It's really a unique and different approach to treatment.
Yeah, I mean, I think to go back to your original question too about potentially other therapies moving from metastatic into the curative intent setting, I think we're going to see parallels to the Extinent trial, perhaps with tucatinib as one of our newer TKIs, and trying to use that to potentially prevent patients from brain metastases. Perhaps that's something else that's coming down the line as well.